Hello, I'm Dr. Miles Deutscher. As president of the Saskatchewan College of Family Physicians, I am honored to tell you about our award recipients. Each year, the SCFP celebrates the accomplishments of our family doctors who provide care to the people of Saskatchewan. Saskatchewan Family Physician of the Year. Each year, the Saskatchewan College of Family Physicians confers this award upon a member deemed to exemplify the ideals of family medicine. Dr. Razawa Maroof has been nominated for her care to the most vulnerable populations and for her compassion and advocacy in learning, clinical and research settings. She is a source of inspiration for colleagues, students and patients and has been instrumental in creating services provided to refugee and immigrant patients upon their arrival in Saskatchewan. She has actively taught medical students, residents, and foreign-trained physicians, all while advocating to ensure her students receive an excellent medical education. Her research highlights her conviction and desire for inclusivity and diversity in family medicine, and she has worked tirelessly to bridge the gaps in care refugees and new immigrants receive.
My name is Razawa Maroof. I practice in Regina, Saskatchewan. I am working at Regina Community Clinic since my graduation in 2002. I also joined the chronic pain clinic and opioid use disorder in 2019. I am also professor associate with College of Medicine, University of Saskatchewan. I joined at 2007. Basically, I am a full-time practicing family physician. I am seeing all ages from 1-day-old baby until 100 years old gentleman, and a part of my practice is global health. I see government-sponsored refugees and newcomers to Saskatchewan. I started that in 2005. I love medicine, and I started when I was 5 years old. When they asked me what you want to become, I always say I want to become a doctor. And they were asking me as a 5-year-old, why I want to do it? I want to make people feel better. So I never changed my mind. You know, a lot of kids when they grow up, they change their mind what they will be in the future. But that was my goal, and I became a physician. And I am glad I did because I love my profession. Basically, family medicine chose me because when I came and did my exams and qualifications to become a physician here, as an international medical graduate, the only chance I got was family medicine residency program. They gave me that chance, and the minute I started, I fell in love with it. I love what I do. I am very passionate about what I do, and I put my heart and soul in it. I think people see that in my practice. So I also do research. I am also an academic person. I do a lot of research to improve both physical and mental health and well-being of the newcomers to Saskatchewan. I am honored because it was a surprise for me when I realized that they called me about the award that my colleagues, my co-workers, and my patients nominated me for this. I am happy because I feel like I'm doing something good in my life, and I'm kind of kind to everybody around me, and I really appreciate that.
The Michael Krochak Award for Contributions to Family Medicine. This award is intended to recognize an individual, group, or organization that has made a significant contribution to family medicine in Saskatchewan through clinical research, educational, or administrative activities. Dr. Kevin Wasko was nominated for his instrumental work and vision for health networks in Saskatchewan. He has also led work in the areas of physician engagement, medical governance, and the academic mandate when a new single provincial health authority was launched.
My name is Kevin Wasko and I practice in Mississauga, Ontario. Right now I'm working primarily in the emergency department because I wanted to gain some big urban experience in a busy, chaotic environment. I initially chose family medicine, even though it wasn't the path that I was on, because the flexibility appealed to me, the ability to have some niche areas of interest, but also a very broad scope of practice, and to be able to have a continuity with patients. Those were the appealing factors for me for family medicine. I knew that I wanted to be a family doctor towards the end of my medical school training when I did a rotation in Swift Current with the physicians there. I was able to see the broad practice that they had, that there was flexibility in the work that they did, that they could have niche practices while still providing continuity of care to patients. And that flexibility, that breadth of scope of practice really appealed to me. And that's what ultimately made me want to become a family physician. My favorite part has been that over the last decade that I've practiced, being able to reinvent myself a number of times. I've gone from being a full scope family physician. I've delivered hundreds of babies. I went to a leadership role and was able to still practice at the same time. And now I've reinvented myself again as a full-time emergency physician. I felt it was an honor, a surprise. I know in the last number of years in working in leadership in the province, reimagining how we could focus on primary health care, how we could strengthen the role of family physicians in the community has been a passion of mine and what I've been working towards. So to have that recognized by my colleagues is an honor and a great recognition.
SCFP Awards of Excellence. The Awards of Excellence recognize CFPC members who in the past 12 to 24 months have made an outstanding contribution in a specific area such as patient care, community service, hospital or healthcare institutions, college activities, teaching, and research. Dr. Paul Naude has been nominated for contributions to cultural safety, population health, and well-being in his community.
My name is Paul Naude. I practice in Lloydminster at the Lloydminster Clinic. I mostly do family medicine involving maternity care and pediatric care, as well as a lot of hospital work involving obstetrics and gynecology. Well, I do what I do because I absolutely have a passion for children and maternity care, and feel in that way that I actually make a contribution to society. Family medicine allows a physician to practice a wide range of medical care and therefore keeps it very interesting. I realized that I wanted to be a family doctor after practicing for a few years and getting to know patients well and realizing that as a family physician I could make a difference in their lives. My favorite part of family medicine is interacting with people, talking to them, making them feel comfortable while they receive medical care. In particular, developing a relationship with children and making them feel comfortable and developing a trust relationship with them. When I heard about receiving this award, I was actually totally taken aback and feel deeply honored receiving it. However, I am receiving it not just for myself, but for all family physicians providing care to their patients, as we all do the same thing in one way or another. Going forward, I think we have a real opportunity in improving the access of our fellow Canadians to the medical care system by increasing the enrollment of family physicians in universities across this country.
Dr. Erin Beresh has been nominated for contributions to interprofessional care and obstetrical practice in her community.
My name is Dr. Erin Beresh, and I am a rural family doctor in Melfort, Saskatchewan. So as a rural family doctor in Melfort, I do a lot of different things. I work in the emergency room here. I help deliver babies. I provide primary care. I provide inpatient care for my patients. I have a very, very broad scope of practice, and from time to time, they even let me teach. So that's been great so far. Well, I actually ended up deciding on family medicine at the last minute. I probably interviewed for more obstetrics programs in family medicine, and as I was nearing the match day, I think I want to work in a smaller place and be able to do emergency medicine and deliver babies. And I probably wouldn't have known that if I didn't have a chance to work with Dr. Amy Sagan from Meadow Lake, who is a shining star of excellence and has been an excellent mentor for me. And if I hadn't had that exposure, I wouldn't have known it was possible. So I think I chose family medicine because of the role models I met. And I'm so happy now. I couldn't imagine it differently now. My favorite part of medicine is obstetrics. My favorite part of family medicine is knowing my patients. I know if there's an incident with one of my patients and they come in emerge and they're in a trauma, I know their family. I know if I have to deliver bad news, I have a good idea of how they may react. I do love the feeling of seeing those well babies that I had the privilege of being there for their entrance. I love watching them grow and seeing their parents grow as parents. And it's really a unique position to be in, to be let into people's lives and just kind of walk with them through whatever they're going through. I feel very surprised about receiving this award. I didn't nominate myself. I just basically shown up. I'm still in my second year of practice, so I'm still fresh. I certainly feel like I came in with a lot of energy, perhaps too much for some people, to try to just focus on quality improvement in our area and to make sure that we are able to provide services and hopefully be able to maintain this service in our small community for a long time, because it's very common that it will fade away and people will need to travel further to seek care. So I feel humbled and honored and excited at the same time.
My Family Doc Rocks Award. The recipients of the My Family Doc Rocks Award are nominated by a patient who felt their doc provided outstanding care. This award is an opportunity to hear from patients about how their family doc made a difference in their lives. Dr. Adeboyega Ketiku. Dr. Ketiku was nominated for his compassion and consistency with his patients and providing exceptional care for his diverse group of patients.
My name is Adeboyega Ketiku. I practice at the Woloschuk Medical Clinic in Saskatchewan. I do family medicine to help care for my patients, support my patients through thick and thin. I love being a family physician on account of the fact that it gives me opportunity to work with diverse group of patients from newborn to the elderly, the aged, and in between the young adults as well. I'm also involved in occupational medicine as well, and making sure that we can optimize patients' health. I got to know I was going to be a family doctor when I did my rotations while in medical school. Overall, I guess family medicine gave me the opportunity to have a full, broad aspect of medicine as a whole, and that was pretty encompassing for me, and that's why I do what I do. Yeah, relocating from Nigeria to Canada has been pretty eventful. It's had its own challenges, but I'm grateful to God. Things worked out fine. My patients have been very appreciative of the care they've received over the years. There's a bit of a cultural shift as well, and you having to adapt and assimilate the new culture as well. My experience back home and in Canada has made me more broad in my thinking, has made me understand other people's culture as well, and has made me more of a better physician to my patients. Receiving this award has been pretty humbling. It's an honor as well. It came as a surprise. I never knew there was even an award like this, but I'm really grateful to my patients. I'm grateful to my colleagues as well, my staff for all the support all through the years. It's a blessing as well. You want to be a blessing to your patients and to people around you. And it's not just me, it's all the family docs, all the doctors in Saskatchewan doing the best they can for their patients. And this is a shout out to all of them.
Dr. David Woloschuk. Dr. Woloschuk was nominated for his caring and professional demeanor with his patients, for listening and providing feedback in a non-judgmental fashion.
My name is David Woloschuk, and I practice at Herald Road Family Physicians in Saskatoon. I do kind of full family practice in the city for about 3/4 of my time, and then about 1/4 of my time I do palliative care now. So I've done everything from delivering babies, my first 3 years in practice, caring right through their life to the end of their life. I kind of started medicine because I thought it would be really interesting, a bit of a challenge, and get to meet a lot of neat people. And certainly it ended up being a really great learning experience. In terms of family practice itself, I think I do it partly because you can kind of do whatever you want. I really enjoyed delivering babies from the first part of my practice, and then when that kind of phased out, I filled it with other stuff that I also enjoyed doing. I probably realized family medicine was the right place for me when I was still in med school. I was kind of on the surgery train. While I really enjoyed it, I think I really noticed that the stress of the job, the hours, the pressure of it was just not where I kind of needed to be. Whereas when I was working in family practice on my electives, and I just found it kind of fit me better. It was nice meeting people, it was nice getting to kind of see the whole gamut of medicine. It's hard to pick one favorite thing about family medicine. I think the most rewarding parts often are the hardest parts, the people that really take a long time to work with, and you get to see that improvement over time. I would say that's probably one of the most rewarding things. I really enjoyed doing deliveries. I think that was always, a bright spot in the day. And then the more I do palliative, I really do enjoy that part of the work as well. I think there is a certain kind of peace and joy in helping patients and families at that kind of more difficult part of their life and getting through or getting over those difficulties in a way that helps them feel whole and happy and well cared for. So receiving this award, definitely I felt very humbled, and I would say honestly pretty surprised. I still feel like I'm very early in my practice, and I don't think I was expecting any awards on the horizon for a long time. So I was surprised, I felt very humbled and very thankful. I think especially the last few years have been pretty taxing on family physicians especially. And so it felt good to know that one of my own patients really recognized the work that not only I, but our clinic, our staff all provide for them. So really appreciative. I'm sure everyone who's receiving this award knows that those who get chosen for the award, that we should share it with everyone else, because we all know that we work hard. I know every single physician in my office would be worthy of this award, and so I guess as much as we can, we share it with all of our colleagues.
The SCFP Medical Student Leadership Award. This award recognizes the leadership abilities of one outstanding medical student in their final year of study at the University of Saskatchewan. Dr. Jessica Froehlich was recognized for her strong desire to advocate for her patients and dedication to patient-centered care. Dr. Froehlich has an evident excitement for medicine advocacy and health policy. Jessica is continuing her medical training in Saskatchewan through the Family Medicine Residency Program, Larange site.
My name is Jessica Froehlich. I'm born and raised in Moose Jaw, but right now I'm working in Larange and its surrounding communities. I am a first-year family resident at the Larange Rural Training Site. I knew that I wanted to pursue a residency training program in Saskatchewan because the programs here are very well known for producing strong family doctors. I think I felt a particular connection with the Larange Rural Training Site after spending some time there during my clerkship. I know that my time in residency is so vital to the kind of physician that I will become, and I know that I will be a better physician because of the patients that I'm privileged to know and care for here. Every day I feel more challenged to be creative, collaborative, more understanding, and compassionate in my work. I chose family medicine because I was moved by the relationships that are formed with patients, families, and community over time. Family physicians are really uniquely positioned to truly see their patients for who they are and to know the person before they know the disease. They gradually form an understanding of their patients' lives, and I think that this allows them to provide care that truly suits the patient's context and experiences. There's many reasons that I knew I wanted to be a family doctor. I was very fortunate to have some strong mentorship from family doctors early on in medical school who guided me along the way. And I think I saw a lot of aspects of who I wanted to be within them. It just felt like a good fit. I also had many opportunities to engage with as a medical student that exposed me to the broad scope of family medicine and helped me to understand the role of the family physician, particularly in how they can work with communities who traditionally may have many barriers to accessing healthcare systems. Of all these experiences that I've enjoyed in medicine throughout my clerkship training, and electives, family practice has really been the most rewarding for me. I find it very exciting and also very replenishing. As someone so early on in my career, it's really provided me an incredible sense of belonging as well. My favorite part of family medicine is getting to know my patients and learning about their lives. I really enjoy watching them find strength and resiliency over the course of their journeys, and as well being a part of their joys and celebration. It's a huge honor to be receiving this award. It made me feel very grateful to reflect back on my 4 years of medical school, just how far I've come and how I've grown in this journey to family medicine residency, which is thanks to many, many wonderful people.